My name is Kenichi Sakakura. I'm Associate Professor in Department of Cardiology, Jichi Medical University, Saitama Medical Center. Coronary stenosis is a cause of angina pectoris and acute myocardial infarction. Typical risk factors of coronary artery disease are hypertension, hyperlipidemia, diabetes, smoking, and obesity, and family history of coronary artery disease. IVUS should be used when we do complex PCIs, especially in left main coronary artery stenosis, chronic total occlusion, or severe calcified lesion. And IVUS give us more accurate and precise information regarding true vessel size and atherosclerotic plaque component such as calcification or thrombus. Other than PCI, coronary artery bypass surgery is an option for severe coronary artery disease patients. And also, most important thing is optimal medical therapy, including aspirin, beta blockers, ACE inhibitors, and statin. It's very important for all patients who have coronary artery disease. Rotablation is used when there is a severe calcification in coronary artery. Because calcification is so hard, we cannot dilate those severely calcified stenosis with conventional balloon or stent technologies. Because rotablation can reduce the amount of calcification, so we can dilate those severely calcified regions with balloon or stent technology after rotablation. That's the point. There are many patients who have severe coronary disease in India, and they probably have severe disease like left main stenosis, chronic total occlusion, and severe calcification, which need rotablator and IVUS. However, the number of Indian physicians who are familiar with rotablation and IVUS is relatively very small. Therefore, training Indian physicians is the most important step for giving better care to patients in India. In Japan, rotablator is used in approximately 3% of all PCIs, and IVUS is used in more than 70% of all PCIs. Those percentages are much higher than those in India. In Japan, most of all interventional cardiologists use IVUS technology, so they can easily access to IVUS, and IVUS help better patient care in Japan. And rotablator is in Japan we have some regulation. Some facilities who have cardiosurgeon and some cardiovascular surgery can do rotablator. It's for safety reason. So synergy stent is one of the latest generation stents. Synergy stents has thin strut because strut was basically thick, and thick strut was not good for it's easy to adhere thrombus. That's why thin strut has advantage. So synergy has thin strut and biodegradable polymer coating. So most of drug editing stents have polymer trim to bring drug to local tissue in coronary artery to prevent restenosis, because restenosis was main problem of bare metal stents, not the drug editing stents. So, however, those polymer is sometimes cause adverse events such as allergy. So that's why biodegradable polymer means polymer will disappear in several months. That is big advantage of synergy stents. Historically, percutaneous coronary intervention was started with balloon angioplasty. Balloon angioplasty has a big problem such as acute vessel closure. Then, bare metal stent has emerged. Acute vessel closure was significantly decreased following bare metal stent deployment. However, there was a restenosis in bare metal stent reaching about approximately 30%. Therefore, reducing technology to reduce the restenosis is most important. So, drug-eluting stent was manufactured. Drug-eluting stents dramatically reduce the rate of restenosis. However, some patients suffered from stent thrombosis, and polymer was one of the causes of stent thrombosis. Synergy stent is the latest generation of drug-eluting stents, and Synergy stent has thin strut, which is very good because thick strut was one of the causes of stent thrombosis. So Synergy stent has thin strut and biodegradable polymer coating. Most of drug-eluting stents has polymer to bring drug to local tissue in coronary artery. However, those polymer is sometimes cause adverse events such as allergy. Biodegradable polymer means polymer will disappear in several months. That is the most important advantage of Synergy stents. So in Japan, all patients have very good insurance system. That's why all patients in Japan can easily access to hospital, including specialists such as cardiologists. Further, calling ambulance is free in Japan. Therefore, if patients have chest pain, they do not need to hesitate to call ambulance and go hospital directly. Such good environment for patients will cause better outcomes for catastrophic coronary artery disease such as acute myocardial infarction. Furthermore, door-to-balloon time for acute myocardial infarction is approximately 6 minutes in Japan. It means patients come to emergency department and take emergent angioplasty within 60 minutes. We are very proud of having better medical system in Japan.